Now let's look at a couple examples of physical agents or modalities that transfer heat via conduction. The first is a hot pack. Hot pack is very common. You will see this in almost every setting, every clinical setting. Basically what you have is a material that absorbs water very well. The water is 165, 170 degrees, and this inner segment here, this piece right here, absorbs water. Gets very hot. This right here, you can see that there is a towel that is wrapped around. This towel is wrapped around the hot pack. You will pack multiple layers of this towel. This towel is an insulator. It is a low thermal conductivity material housing a high, or actually a moderate conductivity material, which is the physical hot pack. So when you apply a hot pack, you are applying a moderate conductive material, the pack itself, at a high temperature, wrapped in a low thermal conductivity material, such as towels. And this is a specific type of hot pack cover that counts as 2 towels, and we'll get into all that in a later class. The next modality we will look at is cold packs. Cold packs are the exact opposite of hot packs. They can be a chemical cold pack, which actually creates a thermal reaction that absorbs heat from the outside, causing it to be cooler than room temperature, and that absorbs some of the heat of the body. The heat is transferred via conduction from the body to the pack. It can be a cold pack that is frozen in a freezer, and you will see there'll be many small refrigerators in a lot of clinics. Because we know ice has a high thermal conductivity, twice as much as metal, we know that we should use an insulator or a low thermal conductivity material, such as the same type of insulator we use on a hot pack. The next example is ice massage. Ice massage is exactly like a cold pack. And this is true conduction. It is 2 materials touching that are at different temperatures. In this example, the heat of the body is transferred into the ice, and the ice will slowly melt. Because there is no insulator in between, this type of modality is usually applied in a smaller time frame and with more constant checking of the tissue. You would use this to reduce inflammation in a tissue, or maybe reduce pain on a tissue you're going to stretch. There's a lot of reasons to use it, but ice massage, since there is no low thermal conductivity barrier between the two, this is a higher rate of conduction. And since we know ice has a very high thermal conductivity rate, we have to be aware of that. Finally, we have paraffin bath. Paraffin bath is simply a slow cooker full of wax, and the patient is able to dip their hand or appendage into the wax. Sometimes you'll do multiple layers and let it cool, dip it again, let it cool until we have a buildup of wax on the hand. Once the wax is cooled, you can peel it off, wash your hands. This is usually used for objects like hands, because the hand is very irregular shaped, and a hot pack or a cold pack, it's hard to cover all of the areas simultaneously, and it's hard, you can miss parts of the hand. So paraffin bath for hand and feet heating, a very good option.